Bismillahirrahmanirrahim. In this video, we are going to talk about the tissue differentiation or identification using the musculoskeletal ultrasound. So, first of all, we are going to see how the muscle is going to appear on musculoskeletal ultrasound. So, I'm applying the ultrasound gel. The machine was frozen, and now I'm unfreezing it, and now you can see that this is the image that is being created just after by applying the gel. But as there is no tissue in front, so we cannot see anything, so randomly we are placing the probe onto the forearm muscles of our subject. Now, just like a camera, we can adjust certain things. For example, right now I'm adjusting the depth. As you can see onto the screen, it is set to 4 centimeters. Now this is 4 centimeter deep, this is superficial and this is deep, this is the right lateral and this is the left lateral. This probe marker can tell us where our probe is. And as soon as I'm going to place the probe, you can see that there are some, let's use the cursor. So you can see this is one muscle belly, this is another muscle belly, and similarly this is another muscle belly, and similarly this is another muscle's belly. So a lot of bellies, and they are encapsulated in the epimysium. This is the epimysium or the fascia of the muscle. We right now we don't know that which muscle is this because we are not following any bony landmarks, but what we can do, we can somehow try to improve the overall quality of the image. And how can we do? We are using 8 megahertz frequency, so let's try to jump a bit higher, and we are now using 11 megahertz. As soon as I press the frequency to 11 hertz, now you see that the structures, they appear a bit more better, and you can differentiate between the fascia and the muscle. So now if we were previously saying that there are 3 muscles, right now we are looking at only one big muscle in one fascia. So that is how you are going to improve the quality of image. And we can tilt the probe in either direction, and you can see that over here you are getting the same facial lines 1, 2 and 3. So these are separate muscles, and this is the short axis of the muscle. If we try to go to the long axis of the muscle, we can see that these are the muscles in the long axis. There is particularly no movement at all. Right now this is the long axis, and we will ask her to just move the fingers. Can you please move the fingers? Now can you see the muscle working? This muscle is working, but this is not working. So which muscle is responsible for moving the fingers? Digitorum, profundus and longus. FTP and FTL. Okay. So if at the same time we ask for the wrist flexion, can you please perform the wrist flexion? Now you see the upper muscle is also moving. So either it can be flexor carpi ulnaris or radialis. Now we need to look at the position of the probe, where our probe is onto the patient's body. So right now it is more towards the medial side. So it is flexor carpi ulnaris. So that is how you are going to differentiate, or you will see the muscles, and clearly you can see the fascia of the muscle. These white lines are hyperechoic lines or hyperechoic regions. That means that these are the areas that are producing more echoes, and this is the fascia, and the muscle is having more water in it. So this is the reason that muscle appears different. See, so it is, and we can, if we want to increase the overall appearance or the contrast, that is sometimes referred to as gain of the image, we can see. Similarly, now this is a more magnified view, but what I have done, I have reduced the depth to 3 centimeter, and now you can see this line, and they are various muscles, the first layer, and then you have the second layer of the muscle. Now, if we want to see what is the appearance of nerve, so let's try to find a nerve. We have found 2 nerves right now, and it is not very difficult, but it is matter of practice. Over here, this is one of the nerve, and similarly this is one of the nerve. So 2 nerves, but let's try to go for the median nerve. You might see this circle. I'm not sure if you are good at visualizing this, but this, we say it has honeycomb appearance. And let's try to slide this all the way up. Now this is a better visualization of the nerve. This is called the honeycomb appearance. Let's go to, I'm not zooming in, I'm just decreasing the depth, and I can also measure what is the depth of this nerve. At this level it is about 1 centimeter from the skin, it's just 1 centimeter deep, and this is the short axis. Now as soon as we try to move more distally towards the wrist, the nerve will become more superficial. Can you please follow this structure? It will, see, it moved from more deep to superficial. Can you guys see this? And you have, it's just a matter of practice that you keep on moving the probe, and still you can somehow try to see the structure. Of course there's a gel missing now. Let's go back where the nerve was very clear. This, let's keep it in the midline, and now I'm going to see this, the very same nerve into this nerve. Okay, this is the nerve. This is honeycomb appearance in short axis, but in the long axis there should be black and white lines. Okay, so as soon as I will try to rotate the probe now, and please look at the screen how I am going to, don't look at the probe movement right now. Can you guys see? I'm doing it again, I'm repeating it for you guys. And now can you see the nerve? Where is the nerve? So can we say that this is the median nerve? And in this median nerve, let's decrease the frequency so we will get a better penetration. This is the nerve, right? Yep. And over here, if we are going to ask our, subject to move the wrist into flexion and extension only, just try to move it a bit slow. Let's go to the very same point. Okay, do it again. Okay, let me try to move it passively. With this, there is the movement of the muscle as well as the nerve also. So the nerve becomes elongated. We commonly perform the neurodynamics, and you can see that this is better. You can see the nerve also move even with this movement, slightest movement. So there is about 10 to 20% of stretch in the nerve that is possible. So we have till now identified the nerve and the muscle. Let's try to see how the tendon appears onto the ultrasound. So for this, we will try to visualize the biceps tendon. So here it is, she can feel, and right now I'm just going to place my probe over there, and now I can clearly see the tendon of the bicep. One thing for sure, bear in mind that there's a lot of screen area that is being wasted. Why? Because we are too superficial now. Now this circular region, this is the tendon of the bicep, because she's too thin actually. And when we are going to, let's try to show you how the tendon appears. There is lack of gel over here. Now the tendon is totally different from the muscle. Now let's change the subject because this becomes a bit difficult. Let's do it on myself. I do have a bit bigger tendon. So I'll try to show you the appearance of tendon first in the short axis and then in the long axis. So first I will try to show you the muscle. Now this is all the muscle. Let's decrease the depth. Now this is, see, this is all the muscle. Okay, Now, as soon as I try to come down, you will see that the muscle is going to become a tendon, especially over here. If you can see this region, I will try to bring it over here. This, okay, and even on top, the round. Can you see this? This round. Okay, so this is the tendon of the bicep. Can you see that moving? Okay, and keeping it here, if I rotate it, can you guys see the tendon's appearance and the muscle down? The tendon is more superficial and is hyperechoic. And look at the muscle. Can you feel the difference? Let's try to. So this over here, if we can somehow zoom in, yeah. So this is the tendon, and this is the muscle underneath. That is brachioradialis. So this is the bicep and this is the brachioradialis belly. So try to see the difference between the muscles belly or muscle appearance and the tendons. So the tendons are hyperechoic, but they don't have any anechoic lines or black lines within them. See, so they are fibrilinear, meaning they have some wave-like pattern, but they are hyperechoic for the nerve, and they don't appear as honeycomb on the short axis. In the short axis, they appear as oval shaped. Usually, the tendons are oval shaped, round to oval shape, but they don't have honeycomb appearance. But the nerve do have honeycomb appearance, so areas of black and white dots, and then you will have the same lines on the long axis as well. Now, if we try to see or visualize the blood vessel, and there are two type of blood vessels we are interested to see. Can you please extend your elbow? Thank you. So we will just place the probe over here and we will wait to see any pulse. We will try to see whether there is any. Let's clear the zoom. Sorry, I have to clear the zoom. And okay, let's lift this up. Do you have blood coming? Really? Our model is too thin. Now I see this is because of just I just changed the position of the elbow and look at the quality of the image. So they keep on changing. Now you can see a better image of the muscle as well as the tendon. It's becoming tendon now, the white part. Okay, so let's see where is the blood vessel. She has very thin blood vessels maybe, or I am unable to. Yeah, I got one. I got one. Don't worry. I got one. I got one. That's it. Please, can you? I'm sorry. You have to hold it over here. This your hand. Thank you. So it appears to be this is one of the blood vessel, but it is not pulsating, and there has to be pulse adjacent to it. Yeah, she has, but she has small. So instead of wasting a lot of time, let's see. You guys can see that blood vessel. That is an artery. Okay, maybe it's just of the positioning. Any, I need to. It is the blood vessel. Why I'm saying it's an artery? Because it is being pulsating. On the top right corner, you might see that. Okay, so let's try to see again on you. It has to be over here, but I think you do have very tiny blood vessels. Or is this different? I mean, can we use, there it is, just above the, see, just above the arrowhead. So this is the short axis. As I told you, this is the short axis of the blood vessel, and you can see that this is pulsating. And now let's try to elongate this and try to see, even at rest, see, you can easily see the blood vessel pulsating. So that's how, this is one of the way. But if you can, let's turn on the CF. It will take a bit of time. Well, let's see. So let's see, where is my blood vessel again. I should come into this region, or you can move the region the way you like. Now you see that red part, that is a blood vessel, and now let's try to extend it. And it has to be, I have to, keep on transforming and adjusting the image till I get the better view of the blood vessel, and then you can somehow, of course, with one hand I can do this, but you can grab the blood vessel, you can visualize it, and then you can adjust the color flow, and then you can somehow see this blood vessel effect using the ultrasound. So we have till now seen the muscle, the tendon, the blood vessel, and the nerve. Okay, so and fascia also. So what is left? Yes, I can show you the joint space also. I can show you the cartilage. Only the superficial cartilage can be seen, but it is important to see or visualize the cartilage. So for the cartilage, we will take the elbow joint, because this is really very easy to scan and quite superficial. Let's unfreeze it again, and please can you keep your elbow straight, and there it is. Now we need to go to the joint space. See, this is the joint space. This is toward the radius. So this is capitulum. This is the capitulum. This one. Okay. And this black line is the cartilage bit, and this is the radiocapitular joint. As soon as you go to the other side, this is the trochlea, ulnar and trochlea joint. Okay. And if we try to see the radial head, can you keep it like this? We already found the head of the radius. Can you go for supination pronation? Yeah, yeah, yeah. Sorry. Yeah, keep on doing. Yeah, keep on doing. This is the head of the radius, and on top of it is the annular ligament holding the head of the radius. And now you can see the difference. Can you please press the freeze button? Yeah, thank you. So right now we are looking at a lot of structures. This is the head of the radius. Of course, this part of the head of the radius does have the cartilage. So you do see the cartilage, as well as on top of it you are looking at the annular ligament, and on top of that you are looking at the muscle. So the muscle, the ligament, and cartilage and head of the radius. So there are 3 or 4 structures that we can see right now. So it is just a matter of practice, that you have to keep on practicing again and again till you should have a good anatomy, knowledge of anatomy. You should have good hands-on skills, and you can practice it the way you want. So I think that's all for this session, and then we will have a discussion about another session.